Thank you and good morning, everyone. First of all, I'm really excited to be back because LA is home for me. I was born and raised just over the hill. So I'm excited to work with all of you and learn from you. So I'm really here just to hear all the great stuff you're doing and how we can support you. And before I move on and talk about the new PACE program that was recently developed, I wanted my colleague, Lieutenant Commander Jose Ortiz, to stand up and introduce himself because we are a small team. It's only him and I. So I'm going to just take a couple minutes to talk about the program Prevention Through Active Community Engagement, which is under the Office of the Assistant Secretary for Health, and really talk about what our goal is, what our objective, and how we can work and support some of the work that you're already doing. So Prevention Through Active Community Engagement, which I'm going to refer to as PACE. The PACE program is really an initiative that came out of the Office of the Assistant Secretary for Health, Operation Change the Map. And Operation Change the Map is really an initiative that is focused on how do we address health disparities and health inequalities at the community level, really understanding some of the disparities through zip codes. So that's really the approach that the OASH leadership is taking, really looking at the community level. And because of Operation Change the Map, flourished the Prevention Through Active Community Engagement. And really the purpose of this initiative is to really understand what is going on at the grassroots level, because we know the work that we're doing cannot be done if we really don't understand some of those barriers, lessons learned, and successes at the community level and what individuals are really facing to be able to end the epidemic. So the program was developed in 3 specific areas. As you can see from the map, we know that there were 48 counties identified as high priority. Within those 48 counties, there were 3 regions that we know have some of the highest HIV infections yearly. And those 3 regions include Region 4. So we have a team there, such as myself and Lieutenant Commander Ortiz, in Atlanta, Georgia, and they cover that area. Then we have another team in Region 6, and they sit in Dallas, Texas, and then us, and we're located here in Los Angeles, California, which is a good thing for me because I'm from here. So Region 9, the PACE program, so myself and my colleague, we cover all of the 8 jurisdictions in California that are working in this phase 1 priority. Then we also work with our colleagues in Arizona, Maricopa County, and then Nevada, Clark County. So that's the area that we cover. And again, really the goal of the PACE program, what the intent was to develop for us to really be in the field and be located in these jurisdictions, because we really want to work with all of our partners, from our federal partners, our state, our local, and most importantly, our grassroots organization with the community health centers. We had an opportunity to visit a great facility that Dr. Mills is the CEO, and it was just really interesting, and it was an eye-opener to really understand some of the issues and some of the barriers that are going on at the level. So that really is our role. Most importantly, we want to be able to work with all of you to identify some of those ongoing challenges. You know, how can we think innovative? How can we move along and be able to end the epidemic? Because I know that all of you have been doing this for decades, and you've been doing a great job, and there is a lot of innovation going on. So we want to learn from you, want to hear from you. We want to be able, how can we identify resources at the federal level, or perhaps communicate and share lessons learned from other jurisdictions to be able to enhance what you're all doing. We also want to be able to leverage our partnership with our other 5 federal agencies leading this and identifying subject matter experts that can enhance some of the work. And most importantly, as our speakers have mentioned throughout the panel discussions, we really are doing this as a one HHS approach. You know, there's 6 federal agencies who are taking a lead at the federal level to address this initiative. We're all one HHS, we're all supporting each other, collaborating to be able to support the work that you're already doing. Some of the ongoing activities that we've been working on, we've started to visit some of the jurisdictions. So I'm hoping to connect with some of you here to be able to visit your jurisdiction, learn the things you're doing, how we can continue support. We actively engage with our federal partners to be able to see how we can address, again, some of the challenges and enhance some of the successes you're doing. And then most importantly, how are we able to connect our partners to some of the resources, or even hear some of the challenges that we can take to our leadership at the OASH to see how we can do things differently. Again, as I mentioned, our next steps, I'm looking forward to connecting with you to continue to visit some of the jurisdictions. Most importantly for us here, we really want to engage with the community, engage in listening sessions to really understand some of those challenges and barriers that our communities are going through. That really is our goal for the next few years, hopefully for a while. All of these efforts, again, are being coordinated and facilitated by all of our federal partners because we need to work together to be able to link you to the community resources that you need. And the really exciting part about this role, again, is that we're at the community level. We've been talking about community engagement and the importance, and it's very important that what we're doing it for the community, and we're doing it because we're hearing their voices. We understand the needs. It's very important because we have to be able to identify leaders in the communities who are able to build trust, who are able to connect individuals to services or prep. So as you think about some of your strategies or innovation or any opportunities, we have to remember that we need to speak to the community to be able to understand really what's going on. And we're here to work with you around community engagement. And again, I'm looking forward to learning from all of you and how we can continue working. And if there's any questions or comments, feel free to reach myself and Lieutenant Commander Ortiz, our contact information there. And if I don't get a chance to reach out to you, please introduce yourself. I'd love to meet all of you and see how we can work together. Thank you.